Hi friends, this is Dr. Aparna and welcome back to my channel. Today in this lecture, we are going to discuss on Kennedy's classification of partially edentulous arches. Kennedy's classification is the most commonly used classification system for partially edentulous arches. This was proposed by Edward Kennedy in 1923. It is based on the relationship of the edentulous spaces to the abutment teeth. He divided all partially edentulous arches into four main types. They are Class 1, Class 2, Class 3 and Class 4. Kennedy's Class 1 states that bilateral edentulous area located posterior to the remaining natural teeth. In the diagram, you can see that there is bilateral edentulous area located posterior to the remaining natural teeth. Kennedy's Class 2 states that unilateral edentulous area located posterior to the remaining natural teeth. In this diagram, it is clearly seen that there is unilateral area located posterior to the remaining natural teeth. Kennedy's Class 3 states that unilateral edentulous area with natural teeth both anterior and posterior to it. In this diagram, you can see that there is unilateral edentulous area having natural teeth both anterior and posterior to it. Kennedy's Class 4 states that single bilateral edentulous area located anterior to the remaining natural teeth. That means single edentulous area is present on the anterior region and on the both sides of the edentulous area, natural teeth are present posteriorly. The sequence of classification is partly based on the frequency of occurrence. That means class 1 is the most common and class 4 is the least common. The sequence is also based on the design principles. Class 1, Class 2 and long span Class 4 are designed as tooth and tissue supported prostheses. Class 3 is designed as fully tooth supported prostheses. Applegate's rules for Kennedy's classification. Applegate gave some rules for Kennedy's classification to make the classification more simpler when we apply in clinical practice. It would be difficult to apply the Kennedy's classification to every clinical situation. Applegate provided the following 8 rules to govern the application of Kennedy's system. They are: Rule 1. Classification should follow rather than precede any extractions of teeth that might alter the original classification. That means if we have to extract any teeth, you should do it before the classification. Rule number 2. If a third molar is missing and not to be replaced, it is not considered in the classification. That means if the third molar is missing and not to be considered in the classification, then you should just leave it. Rule number 3. If a third molar is present and is to be used as an abutment, it is considered in the classification. That means if the third molar is present and if we want to use it as an abutment, then it is considered in the classification. Rule number 4. If a second molar is missing and is not to be replaced, it is not considered in the classification. Rule number 5. The most posterior edentulous area or areas always determines the classification. That means the most posterior area determines the classification. All the remaining edentulous areas will not determine the classification. They are considered as modification spaces. Rule number 6. The edentulous areas other than those determining the classification are referred to as modification spaces and are designated by their numbers. That means, as we said in classification 5, the most posterior edentulous area determines the classification, and other edentulous areas are considered as modification spaces. That means if one space is missing other than the most posterior edentulous area, then it is said as modification 1, and if two edentulous spaces are present other than the most posterior edentulous area, then it is called as modification 2, and so on. Rule number 7. The extent of modification is not considered, only the number of additional edentulous areas. That means how many teeth are missing is not considered, only the number of edentulous area is considered. Rule number 8. There can be no modification area in class 4 arches. The other edentulous area have to be posterior to this edentulous spaces and will hence determine the classification. That means class 4 is more anterior edentulous area. Any edentulous area will be posterior to it. According to rule number 5, the most posterior area will determine the classification. So, if any posterior edentulous area is present, then it will now be longer class 4. So, if it is a class 4 classification, then there won't be any modification spaces. Let's discuss the merits of Kennedy's classification. The classification is simple and universally acceptable. It allows to clearly communicate, write, or diagnose the condition of the oral cavity in which missing teeth are to be replaced. It permits visualization of the type of partially edentulous arches being considered. Classification is based on the relationship of the edentulous spaces to the abutment teeth, so the type of support can be easily determined. The number and the location of edentulous spaces can be identified, but does not indicate the number of missing teeth in each edentulous area. The classification provides design for each class. The guidelines and principles for each class have been proposed. So we have discussed the merits of Kennedy's classification. Now let's see the demerits of Kennedy's classification. They are: it does not assess the choice, number, location, and condition of the abutment teeth. Assessment of the hard and soft tissue status is not possible. It does not indicate the position of individual tooth. It does not permit assessment of occlusion. In this session, we have discussed in detail about Kennedy's classification of partially edentulous arches, Applegate's rules for Kennedy's classification, merits and demerits of Kennedy's classification. I hope this video will be helpful for you. Please do subscribe to my channel and click on the bell icon so that you will be notified when I upload new videos. Thank you.